As more cases of coronavirus are being detected in India, a high-level committee of the Health Ministry has been formed to essentially review preparedness of our administration. Prime Minister Narendra Modi has asserted that there is no need to panic and that all states and the central government, they're all working together to contain the spread of the virus. The Cabinet Secretary held a review meeting with the secretaries of concerned ministries, chief secretaries and health secretaries of the states. They've all been asked to review and assess the action taken for the containment of COVID-19. In a move to prevent shortage of essential medicines, the centre has restricted the exports of a host of medicines. Air India has cancelled several flights going to Seoul, Tokyo and Bangkok, among others. The DGCA has asked all airlines to disinfect all aircraft arriving from South Korea, from Japan as well as Italy.
Okay, any problem?
And Rajdeep Sardesai also spoke to Union Health Minister Dr. Harshvardhan yesterday, who asserted that there was absolutely no need to panic over the coronavirus crisis.
Joining us now is a very special guest, the Health Minister of the country, Dr. Harshvardhan, on the big coronavirus scare. Appreciate your joining us, Dr. Harshvardhan. 2 positive cases detected in the last 48 hours, one in Telangana, one in Delhi. It spread an element of panic. What would you say as the Health Minister? Is this panic and scare over coronavirus justified or not?
See, a concern is okay, but panic is, I think, not justified, neither necessary. You have to appreciate that we have been working on the prevention of the entry of coronavirus in the country for almost, I would say, 45 days now. We started the whole thing on 17th of January, 2 weeks before the World Health Organization declared it as an emergency of international concern. And you have seen that in a country of 1.35 billion people, we have till now only these 5 cases which are positive, and another Italian who has also traveled to India who has also come out as positive. I think there is no cause for any panic at all, and I would urge upon people like you and your television channels also to help us in appealing to the people, because they have to just take some simple precautions about hygiene, cleaning of hands, maintaining etiquettes while coughing, sneezing, and then reporting to the system if they have some fever or maybe some sore throat, some respiratory difficulties, and of course, yes.
No, while you say there is no need for panic, while you say that in a large country like India, we've just had a couple of cases, how prepared are we is the question, because here you've got a situation which could spread. I'm not saying it will, it could spread. How prepared are we? We have only 5 laboratories for testing, I'm told, when according to health experts, the minimum is 29. There are questions being raised over the manner in which screening is taking place at the airports. How prepared are we?
I think we are thoroughly prepared, and I think you are probably, you see, information is not correct. Number one, right now, we are already doing this testing in 15 laboratories in the country. That's number one. By tomorrow, another 19 laboratories are going to be starting their functioning. That's number 2. And even at this stage, we are in a position that by tomorrow we will be creating 1 laboratory with scientists and all the equipment and all the reagents in Iran itself, to make sure all our Indians, we first test them there, because that is the request that we had made to the Iranian officials also, but they said they may not be able to help us on that. So we are creating a laboratory there itself. Already 1 scientist has gone there, 3 scientists, and everything is going tomorrow. So that's number one. As far as the screening is concerned, I think we started with the screening process on 17th of January, and by now we have already screened at 21 airports 5,89,438 people, and at our 12 major seaports and 65 minor seaports, we have already screened something like 15,415 people at our borders with Nepal, that is with UP, Uttarakhand, and then Bihar, Bengal, and Sikkim. We have screened over 10 lakh people there and have organized something like 3,500 to 4,000 Gram Sabhas in the neighboring villages, and already 27,481 people are under community surveillance. I think we have one of the best integrated disease surveillance system in this country now.
Right.
And that is all because of this. And number one, and number two, we are the whole country is coordinating all the efforts every day. We are on video conferencing. We are in touch with the chief secretaries, health secretaries, with the DMs of the whole country, and everything is being monitored. Every aspect of the disease prevention and its spread, how we handle it, is being monitored at the highest level, whether it is at the level of the Prime Minister, whether it is at the level of...
you said, sir...
So I think we have probably
You're saying we have one of the best systems in place. A statement of the health ministry itself, which you head, Dr. Harshvardhan, says the person who's tested positive from Delhi has a travel history from Italy, while the one from Telangana has a travel history from Dubai. So despite all the efforts, presumably people with Karo who are testing positive can slip through the system. Is that a worry at all?
You see, you have to appreciate that the screening is done where you do a thermal screening. If the person has temperature, then you get some idea about it. Now we are, number one, every passenger is supposed to be writing a self-declaration form with all the details about him, his travel histories, etc. And then you have to also appreciate that there is an incubation period. Today, if somebody is having a disease, but if he is not symptomatic, he can develop the symptoms in the next 14 days. So, you see, it is all because of the strong community surveillance system that we developed, and the system where we have all the telephone lines, all the mechanisms to remain in touch with these people with the help of our surveillance officers. That is why, you see, if you will be able to appreciate this when I tell you that for the first 3 cases that were admitted in Kerala, we did a contact tracing. For the first case, we traced 81 contacts. For the second case, we traced 71 contacts. For the third case, we traced 162 contacts. And for this Telangana patient also, we have traced 88 contacts. And for the Delhi patient, we have traced 46 contacts. So, you see, we are having the, I would say, the most meticulous, keeping a most meticulous watch on everything that's likely to happen, that's happening, and that's why we are so confident, and everyone in the system is on thorough alert.
So it's good to have a minister coming on the show with such details that you're giving. I really appreciate that, but I just want to understand, the government has already suspended travel to China and Iran. Are there other countries also, sir, which are now on the watch list of the government?
You see, as per the latest travel advisory that we have issued today, I would say that for anyone traveling from Japan, Korea, Italy, and Iran, and of course China was already there for. So all visas, e-visas, etc., which have been issued even today or before that, they all stand suspended. So that's the latest position on this, and we are advising people not to have, you see, unnecessary travel to those countries. The number is now 75 which are sort of affected with coronavirus right now. So there is a detailed travel advisory that we have given to the people.
Can I also ask you this? You know, you are someone who is not just a politician, but you were a trained doctor. But you know, we are hearing many bizarre statements from political leaders prescribing ways to deal with coronavirus. One of your MLAs in Suman Harpriya says Gaumutra, Gobar could cure coronavirus. Yogi Adityanath, Chief Minister, suggests yoga to fight coronavirus. Swami Chakrapani Maharaj, President of Hindu Mahasabha, says consuming cow urine and cow dung will stop the effect of infectious coronavirus. Isn't the time come to please tell them that this is no moment to put some kind of magical cures which they believe exist out there? This is a serious problem that requires serious medical cures.
I would agree to you. I would fully agree to you with you that I think statements like this coming from anyone without knowledge of the particular subject, and for a virus which has just emerged, the whole world is noticing the novel coronavirus now. I think statements like this, from irrespective of from where they have come, as a doctor also and as someone who has known the subject and studied the subject in great detail, I would not support any such statement, and I would like people only to follow simple precautions. There is no rocket science in preventing the spread of the whole thing. You have to just maintain hygiene, wash your hands regularly, just have some etiquettes while you are coughing, sneezing, and then report to the system. You know, and just keep your you see surfaces with which you come in contact clean and all. That's what is required.
That's precisely the issue in a country like India. According to the 2019 Global Health Security Index, the national health security of various countries is fundamentally weak, and that many countries are not fully prepared, therefore, for epidemics of this kind. The last mile monitoring that is needed, the cleanliness, the hygiene that you speak of, in many hospitals perhaps doesn't exist. So that's the fear that comes in a large country like India, the last mile monitoring. Does that concern you? You're saying you're in touch with DMs, chief ministers, but to what extent do you fear that the last mile monitoring is taking place with the same adequate preparation that it needs to be, sir?
You see, we have ensured in the last 45 days or so that we are very actively in touch with the whole health system. And you see, these are not the old days. Now, there is a very good quality health system available everywhere. And even in spite of that, you see, on 6th, that's a few days from now, we are having another, you see, great training of national training of all the relevant trainers for the whole country. And then on 9th, we are going to have similar training in all the states. So we are already in touch. It's not only with the DMs we are in touch with all the systems, health officials, doctors, and I think most of the things that we are wanting them to do, we have already created good quality isolation beds even up to the district level. All those things have been worked out in great detail in the last
we have enough isolation facilities, Mr. Minister? We have enough isolation facilities across the country?
Yes, of course. Yes, we have already been, we are already in touch with all the health ministers and the system, and we have already ensured that we have isolation facilities at every place.
Okay. Mr. Minister, the impression you're giving me is that you are fully in control of the situation at the moment. That is reassuring to hear. But as you know, this is a public health emergency that will require constant monitoring. I appreciate your joining us on the show tonight. Thank you very much, Dr. Harshvardhan, the Health Minister of the country. Let's take a break. We'll be back with more.
There are many precautions that we as individuals can and must take to protect ourselves and to prevent the spread of coronavirus here in India. But what all measures has the government taken so far, particularly at airports? India Today's team of reporters spread out to report on the ground realities from different airports across the country.
As India confirms 3 positive cases from coronavirus, airports across India are on high alert. The Ministry of Health has issued an advisory to tighten screening at all airports. Health counters and thermal scanners have been stationed at the pre-immigration area for the passengers. Passengers feel there is a need to increase awareness about the deadly coronavirus.
I guess थोड़ी सी और preparation की ज़रूरत है, because I see here कि लोगों ने पहना ही नहीं हुआ है, and but they need to understand this that it is spreading widely.
It'll hardly take a very little time for the virus to spread, so I think we should be a bit more concerned about our own safety.
21 airports have been fitted with screening machines. Stringent screening is taking place not just at airports but also at various seaports. The government is also saying that the Prime Minister himself is closely monitoring the situation and also looking at the number of patients in the country. Very recently, there were 3 people, one in the national capital, the other in Jaipur and the third one in Hyderabad, who were tested positive.
Flyers in Chennai could be seen taking preventive steps. Many were spotted wearing masks.
As I'm a doctor, I'm aware of like what kind of viruses, like how we can get infected from passengers, co-passengers, and by touching places like public places. And I used to sanitize myself throughout the journey, and by wearing mask, I want to protect myself.
Yes, minor precautions, nothing excessive. I'm washing my hands regularly, and just when I'm in close proximity with other people, I'm wearing the mask.
As many countries are trying to combat the coronavirus, even at the Chennai International Airport, all measures are put in place. The entire staff has been briefed by the airport authorities on how to tackle the system. Now, passengers, when they take their flights, in the flight, are given out pamphlets which they have to fill and return to the crew. They have to be upfront if they have a fever, if they have a respiratory disorder. They are expected to tell the crew that. As soon as they land, they all undergo thermal scanning, and anyone with a fever or a cold is kept aside. There are ambulances such as these outside the Chennai International Airport.
At the Kolkata airport, passengers coming from various Southeast Asian countries are being screened through thermal scanners.
For precaution, we are keeping this mask with us, and as it's an international airport, so anything can happen.
Passengers who are coming in from Southeast Asian countries, specifically from Thailand, Malaysia, Indonesia, all these countries, those flights are being screened heavily, and all those passengers will have to submit a declaration, a health form, which has been given on board the flight. When they alight the flight, they will have to fill that up, and there is a specific desk where health officials are there. So first, the passengers will have to submit that form and also go through a thermal scanner screening.
Mumbai International Airport has also increased screening.
Mumbai International Airport is maintaining high vigil and screening passengers arriving from around 14 countries. These countries are China, South Korea, Japan, Italy, Iran, Hong Kong, Macau, Taiwan, Singapore, Thailand, Malaysia, Vietnam, Indonesia and Nepal.
As the worldwide death toll due to coronavirus crosses 3,000, India is taking no chances. Screening is being tightened at airports across the country. Bureau Report, India Today.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.